Breastfeeding is freaking hard and I had no idea about it. So please watch this entire video so you don't make the mistakes I made and you don't have to end up stopping breastfeeding like I had to. I mentioned in my previous video that I thought breastfeeding was easy, that it was a whole natural thing where you just put your baby on your chest and they come, they latch, you feed them and everything's beautiful. But no, you must learn techniques, you must learn your baby, you must learn your own body, and you have to be very patient and kind to yourself and to your baby so you can have a successful nursing experience with your baby. And even then, in many cases, there's still a lot of crying from your baby and from you, a lot of pain and sleepless nights. Now, I don't want to say that you're going to go through what I went through because everybody's different, and I have known people with wonderful breastfeeding stories, but I have known a lot of people with difficult breastfeeding stories or people that went through hard times before things got better. But I have to say, I'm the worst story I know, and I'm sad about it because it's not what I wished for myself, but this whole thing happened to me because of lack of information, lack of education, and also unique circumstances that my baby and I went through. Also, something else that happened is that I was obsessed with breastfeeding during my pregnancy. It's all I wanted to do. I was reading books about how important it was, and I created my own judgment against formula feeding. And while I know that breastfeeding is the optimal thing to do for your baby, formula feeding and other options to take care of your baby are still good things, are still available, and you should take advantage of them if breastfeeding is hard. But before I tell you about all the things you should know about breastfeeding, so you don't make the mistakes I made, I want to break the stigma behind formula feeding. As I said, breastfeeding is the optimal milk you can give to your baby because it contains all of the nutrients and antibodies that your baby needs for its development. Breastfeeding also creates a very, very special bond between you and your baby. It feels very emotional and nurturing and amazing. And another benefit about breastfeeding is that it's less work than formula feeding because you don't have to be sterilizing bottles or cleaning bottles or buying formula, spending money there. Breastfeeding is free. So those things are positive things. However, there's a lot of work that can come with breastfeeding, and I'll explain more later. But on the other hand, formula feeding has benefits as well. It does provide consistent nutrition for your baby. It allows other people to help you with the feeds during the day. You're not the only designated human that can feed your baby. That can be a full-time job, and it's hard if you need to go back to work or if you're tired, if you're sick. Many things can happen. You can't always be there for your baby, so in those circumstances, other people can help. For example, right now, my baby is starting to cry because he's hungry, and then my husband is gonna go make him some milk so I can continue to record this video. Here's the baby boy. He's always crying on YouTube. Oh, mi amor. We're gonna feed you right now. Daddy has your bottle ready, right? Mm-hmm. Daddy, you're gonna feed this baby?
I am.
Thank you. There you go. That's a benefit. And then one more thing that's great about formula these days, at least, is that there are many, many options. My baby has an allergy to cow's products, so we have a special milk for that. So I don't have to go on a diet where I can't eat cheese or steak or butter or yogurt. I can eat all of those things because I'm not breastfeeding, and then he can have his special milk. Then there is also a goat milk type of formula that we want to try next. That's a benefit, that there are a lot of options out there, especially here in Europe. There are great options for formula feeding. Ultimately, the decision of breastfeeding is completely up to you. I know that right now, at least I feel that there is some pressure with breastfeeding, like moms of our generation want to breastfeed, not moms of our previous generations. They didn't want to breastfeed, but yes, we want to breastfeed. I wanted to breastfeed, but sometimes it's not possible. And there's something that a lot of moms told me, and that is happy mom, happy baby. If breastfeeding is making you miserable, if it's making you sick, maybe you have to be open to other options like formula, which is a great alternative. I was formula fed, my husband was formula fed, everyone I know of my generation was formula fed, and we're completely healthy and good people. So formula is good. Things you should know about breastfeeding. Breastfeeding is a skill. It's not an easy process. Yes, it's natural, but remember, humans are the most vulnerable newborns that there are out there. If you see a, I don't know, baby horse newborn or a baby squirrel newborn, they know what to do to feed themselves. They go to the mom and they latch and everything's great. Maybe, I don't know, animals feel less pain. I don't know what's the deal with other animals, but we need a lot of help from our mothers. For that, there are skills that you need to learn, probably courses that you need to take. You need to spend a lot of time on educating yourself on breastfeeding. Why? Because unfortunately, no one ever teaches us about this whole situation. In my case, for example, my mom thought it was important to preserve her body, to not complicate her life with breastfeeding, which she could have bottles and formula, and a lot of moms were like this. So she thought I was going to do the same thing, and then when I gave birth, I was like, whoa, what is this? So learn as much as you can. Follow all of those great Instagram accounts out there that have videos on how to latch, how to breastfeed, how to maintain your milk supply, and all of that stuff. Honor the golden hour. The golden hour is known as the first hour after birth, when a mother has uninterrupted skin-to-skin contact with her newborn. Besides meeting your baby right after you deliver, you want to give him his first feeding session. You may not have any true mature milk to provide to the baby, but this first stimulation to your breast tells your brain that your baby's here and it needs milk, so you need to start producing milk. The first milk you're gonna give to your baby is called colostrum, and this milk is very nutritious. They call it like the golden milk or something like that because it's yellow and it's thick and it comes out in small quantities, but it's really nutritious for your baby and to help them start their digestive system to run. Whenever you're going to give birth, ask the nurses to respect this golden hour between you and your baby. I think that the best position to have the first feed is in the biological position, where you're going to be completely laid down or like in a 45-degree angle, and then you're going to put your baby on top of your chest and you try to guide them towards your nipple and then have them latch. Don't worry about really having your baby's belly full, because as I said, this is a very small amount of milk that you're going to give to your baby in the golden hour. All you want to do is get that introductory stimulation to your breast from your baby. Things to know about your milk. So during your pregnancy, there are hormonal changes that create breast tissue where your milk is going to start flowing and producing and all that. Then when your baby is born is when you start producing or releasing that colostrum, and then around day 2 to day 5 you're going to finally release your mature milk or your real milk, the one that's white that we all know about. A lot of moms get frustrated when the baby's born and they're still not releasing milk. I remember being really worried about this in the beginning. I would cry because I thought that I wasn't feeding my baby and I didn't have milk, but I did have milk. I think I started to have my first true letdowns of milk around day 2 or 3, which was really great, but sometimes it can take longer. Now, this is very important. Breast milk operates in a principle of supply and demand. The more frequently and effectively that the baby breastfeeds, the more milk the breast is going to produce. The sucking action of the baby at the breast stimulates nerve endings that send signals to the brain to release prolactin. And this is the hormone that is responsible for producing milk. So again, if during the first days of your baby being born, you are skipping feedings and you're giving your baby bottle or another substitute, you are going to maybe potentially fail to produce the amount of milk that your baby needs. I know it's really hard. I know you're going to be tired and sleepy and cranky and all, but you should be very consistent at least the first month, giving your baby as many feedings as you can, if not all, so your milk production is adapted to your baby's needs and it provides the milk that the baby needs. Cluster feeding can be really taxing on the mom. It's a phase that the baby has where they start to eat every 20 minutes or 30 minutes or every hour. It feels really non-stop. It's really exhausting, but this is what tells, again, your brain that your baby is growing and that you need to produce more and more milk. Now, there are complexities about positioning and about latching. I didn't know this. There are several positions that you can use for the best comfort of you and your baby. There are many, I'll put them in the video, but you need to know that the most common position that they teach you at the hospital is the cross cradle position. So in this position, you're going to hold your baby's body with your left arm. For example, if you're gonna put your baby on the right breast, then with your hand, with a V form like this, you're gonna hold the base of the neck of the baby. And with your right hand, you're going to compress your breast in a way that it can fit your baby's mouth. Simultaneously, you're going to rub your nipple on your baby's nose so they understand that they have to open their mouth. They're going to be able to smell your milk. Once you're doing all of that, when your baby finally opens their mouth wide open, you have to push your baby towards your breast so they can latch. And then the first few seconds that your baby's sucking, you're going to feel pain, which is the let down pain, and then your baby starts to feed. That to me was extremely complicated when I had no idea that this whole system existed, when I had just given birth for the first time in my life and I was given medication, the epidural. I was all over the place. It was too much. I couldn't do it, and yeah, it was just really hard. Please learn all the techniques and practice them before you give birth. You can practice it with a doll or do what you need to do, but make sure that you feel comfortable with one technique, and then when your baby's born, that you both feel comfortable with one position or technique, so breastfeeding is successful. Your boobs can get sick. I had no idea there was such thing, but yes, like engorgement, which happens when you don't empty your boobs. And that happens when maybe there is a case of your baby not latching correctly, not feeding correctly, or falling asleep during the feed, so you are left with your boobs full of milk or with some milk, and then that creates some swelling and discomfort, and it can be painful and annoying. Mastitis, which I got 4 of. So this happens when there's an inflammation in your boob, because again, there's milk that it's there that wasn't emptied out, that creates an infection. It also happens if you have cracked nipples that are not getting cured, and then the bacteria enters the cracked nipples and therefore your milk gets infected. The way you treat this is with antibiotics and ice packs, and also trying to help your nipples to get better, but it can be really complex and the symptoms are really intense. It feels like you have the flu. Don't recommend it. It's not fun. Sore or cracked nipples or nipple trauma. This happens when there's improper latch, when there is tongue tie or lip tie or other unique circumstances that can happen, and it can be really painful. I still have cracked nipples from nipple trauma, I think like level 5 that I had. So yes, you want to take care of your nipples so you don't suffer like I did. Blocked milk ducts, which I also had. This again happens when you're not draining your boobs and there's milk there, and you're gonna feel lumps of milk that are really painful. So what you have to do is that when you are pumping or breastfeeding, you want to massage them in circular motion so you can dissolve them. It can also happen from using really tight bras, so make sure you don't use those. Breast axis is a collection of pus that is stuck there in your breast tissue, and it usually happens after unresolved or severe mastitis. Thrush, which I also think I got, it is like a yeast infection that you get on your nipples, and you're going to feel extreme soreness to the point that not even the air can touch your nipple because it's so painful, and flaky skin around your nipple, really red or pink nipples, and what else? Bright skin on your breast. And then the bad part is that your baby can also get it, and they're gonna get white dots on their tongue. The pictures online look really scary. My baby didn't get it, but yeah, also not cool. And I'm sure that there are more things that can happen to your boobs, but these are all the ones that I know and the most common ones. My recommendation is that you learn all of them so you are prepared in case something happens and you're not surprised like I was. That way you can be more proactive and get better really quickly. There are baby problems too. I also didn't know about this, but there's something called tongue tie or lip tie, which means that there is a fiber or skin that restricts your baby's ability to suck comfortably. This interferes with effective nursing and it will cause you a lot of pain because your baby is going to find ways to compensate, and because of that they may use their lips more or not suck really deeply, and that's going to cause nipple trauma. He pooped? Hold on. Diaper change. But I mean, look at this. Hello. Hello. Little smiles for YouTube. Hey. Hello. Oh my goodness. Okay. See you soon, baby. Also, babies that are born premature or with low birth weight struggle to coordinate, to suck, to breathe. They fall asleep at the breast, so this can also cause problems. Jaundice. So this is another problem where your newborn may appear to have yellow skin due to elevated bilirubin levels. Babies with this condition may seem sleepy and they may have difficulty feeding, waking up for feeding, so this also causes problems with breastfeeding. So if you see yellow toned skin in your newborn, please go to your doctor ASAP. Nipple confusion. This also happened to me. This happens when you use a bottle to feed your baby when you are breastfeeding before your baby is 1 month old. You're going to see that all lactation specialists tell you not to use bottles or pacifiers before they're 1 month old because the sucking that is performed with a bottle or with a pacifier is different from the sucking that's performed at the breast. So with the pacifier or with a bottle, the baby is going to suck mostly with their lips, like that, creating a lot of pressure in the tetine, the nipple. But then when you have a baby latched onto your breast, their mouth is wide open and they're sucking with their soft palate, which is so different from what they're doing at the bottle. And keep in mind that sucking a bottle is way easier than sucking at the breast just because, you know, the milk flows faster with the bottle. So they may develop a preference towards the bottle, or they may feel confused between nipple and bottle. Nipple, yes, this is going to cause you a lot of pain if they get nipple confusion. Let's be real, there may be times where you are not going to be able to nurse your baby. You may again get sick, you may have to go to the doctor yourself, who knows, something may happen. So the alternatives that lactation consultants recommend is to use a cup to feed your baby, a spoon, or your finger with a syringe, and feed your baby using those techniques is what they think it's best. It's a lot of hard work, and maybe, you know, people around you are not going to want to do it because it's complicated, but this is what they recommend so your baby doesn't develop nipple confusion. Postpartum mood disorders can also make a breastfeeding really hard. If you are extremely preoccupied like I was about my health, or if you are depressed, if you have low mood, you are going to struggle with breastfeeding because, again, there's so much involved in the technique, the positioning, the latching, that if you're extremely tired, you may fail to latch your baby properly, or you may be in a bad mood, and a lot of things may happen. If you're struggling with postpartum depression or anxiety, get the help that you need so it doesn't interfere with nursing your baby. I did not know there were so many things in the market for your boobs, but there are nipple shields, breast shells, breast pads for milk, special bras, ice packs, breast silver cups. There are nipple gel pads that are really, really helpful if you have cracked nipples. Nipple balms and ointments and creams and lotions and all that. There is also a latch assist or a nipple correction device thing that helps your nipple come out if you have inverted nipples. Yeah, there are many things out there, so start researching all of the things that can help you make your experience with breastfeeding better, because there are tons of things that you can get for yourself. Finally, there are professionals that can help you. I also did not know about this, but there are lactation specialists that can come to your home and help you, or you can go to their office and you can practice. I recommend you get them in the 3rd trimester so you can start practicing before your baby comes, and then when your baby is home you can try 1 to 2 sessions with the lactation specialist, just so you can learn things about how to massage your boobs, how to maintain your milk supply, how to store your milk, how to latch your baby, and etc. There are so many things that involve breastfeeding, and I think that we need to reach out to professionals to get the best help we can get so we can have a successful and happy experience with your baby. And if there's one thing I want to tell you is, do not overestimate your ability to breastfeed your baby. Many things can happen, and if you care about maintaining that milk production and relationship with your baby and breastfeeding, it's best that you get the help that you need now. If you have any questions for me, or if you want to share your experience with breastfeeding, please leave comments down below, and I'll see you soon in another video.